With that, we will officially kick off our COVID conversation number 4. Welcome, everyone. I'm Dee Dee Montgomery on behalf of the Oregon Institute of Occupational Health Sciences and the Oregon Healthy Workforce Center, with support from the Oregon State Association of Occupational Health Nurses and our ASSP chapters. We're really glad to continue on our COVID conversation. I'm going to turn it over to my coworker, Nicole Guilfoy, in 1 second. But before I do, yes, we are recording, and you've hopefully found our YouTube station, and we will put that into our blog coming out so you can find this and share it. Our next COVID conversation will be on the April 13th with Cliff Butler, Environmental Health and Safety Manager for Sherwin-Williams. And we have decided we will continue to hold this through June. We will probably then stop our COVID conversations as we complete the month of June, as it looks right now. Not that COVID will be gone, we know that. And with that, again, thank you, June, and welcome. Nicole, I'm going to turn it over to you. So thank you for hosting today.
Thanks, Dee Dee. Well, it is my absolute pleasure to introduce to you June Vining. June is nationally recognized for her management and training skills and abilities. She's the CEO and Executive Director of Trauma Intervention Programs of Portland and Vancouver, Inc. for over 28 years. June is responsible for recruiting, training, and supervising citizen volunteers to provide emotional first aid to citizens in crisis. She's a certified master trainer with the National TIP organization. She was named the 2000 recipient of the Athena Award, which is presented to women with outstanding leadership and community service by the Vancouver Chamber of Commerce and Women in Action. She is one of the 15 fascinating Oregonians from Brainstorm Northwest magazine and was awarded Communicator of the Year in 2002. With June's leadership skills, she has successfully had the Emotional First Aid Seminar certified. She has traveled cross-country, teaching people what to say and what not to say when dealing with people in crisis and with coworkers who are traumatized by life, and training first responders with this course. June is recognized through her work with TIP as the coordinator who can organize, plan, and implement diffusings and debriefings for citizens and businesses that are traumatized after a death or a crisis situation. June, thank you so much for joining us today.
Yes, thank you. I'm happy to be here.
It's wonderful. Well, your insight is going to be so helpful to all of us as we are working toward understanding how we can best support employees and scaffold our ability to become resilient as a community and as individuals and families and workers. So what type of mental health issues, short or long term, are you hearing from your clients that should be of concern for employers?
Gosh, you know, in the midst of everything that's going on right now, in light of the shooting yesterday and COVID and fires and just the turmoil that city of Portland and the greater area is feeling, it's people have this sense of just angst and anxiety of what's going on. For a lot of us, our workplaces have changed. And we're working from home. And I'm not telling you all anything that you don't know. We have people that are working from home that now have to deal with either kids and online schooling or daycare issues or just sharing internet and bandwidth. So there's all of that anxiety about trying to do the best thing. Other big thing is now that people are working from home, if you're not somebody that has normally worked from home, like I have 3 staff people, there's just 4 of us. I'm the only one who has an office. The rest of them work from home, is knowing how to set good boundaries and when to quit working. Because if your dining room table or living room or kitchen table has become your work office, how do you really close it down at the end of the day and not work? So people are working kind of nonstop. So they feel like they're never getting away from work, never getting a break. So these are all mental health issues, never feeling like they're doing enough or they're doing good enough at being a parent or being a worker or being a spouse because they're spread so thin.
So really opening up the conversation to the physical environment and to also include the social environment in a way that we haven't had to discuss before.
Exactly. And another big one that's come up is in normal everyday pre-COVID time, if we're working and we had a question, we could look over at our coworker and say, hey, how do you do this? And now it's literally, you have to set up a meeting or a Zoom call or something. I'm thinking about this. My daughter is in DC. She's a federal prosecutor that just went to the US Attorney's Office, and things that normally she could just ask her, just say, hey, how do you do this? Now it's like a big deal to go through a process on just how to scan a document into the right place because they're working remotely. So all these things that are normally little tiny things are now really big issues for us.
So these conversations are now where we might have sort of pushed them off to, oh, that's not about work. That's the non-occupational piece. Now it is coming into our work lives, and it does need to be addressed. And these are new boundaries, aren't they, that are shifting? Yeah.
Right.
So
we're not leaving an office and closing the door. It's like we're walking out of the room and we walk back in the room and it's like, oh, it's still there.
It's still there, isn't it? It's there. I woke up one morning very recently, and the first thing I did was check my work email from bed.
Yes.
So I think
so that, you know what, Nicole, that's my first, suggestion with people on setting boundaries. It's like, Friday afternoon when you're done with work, we're not checking email all weekend. You're turning it off. You're turning off the alerts. Unless you're emergency response and you're required to respond, you're turning it off. You have to physically do something to be done, go through a routine, and then don't start until Monday morning when you get up. You don't need to be, going to work at 6 a.m. unless that's your job. So don't start checking those. Don't respond to emails at 10 or 11 or 12 o'clock at night just because you're sitting there and you're bored, because now you've trained everybody that you're available 24/7. So number one is set good boundaries on when is my work hours. If you read an email at 11 o'clock and you want to respond, put it in draft. Don't hit send until the next morning.
Yes, I did try to send an email at 6:30 in the morning one time, and I realized I should have given myself a cup of coffee or a little bit of a walk before I did that. There were typos everywhere. So now, and for our audience today, June supports sworn public safety members for the city of Portland. That includes police officers and firefighters. But June is also supporting folks who work in a more traditional environment. And so given these changes in the work environment, do you have any thoughts on how employers can make accessing EAP easier for eligible employees?
Yes. So the first one is we need to talk about it. We need to make it part of our routine. So, and again, I realize with this group, I'm kind of preaching to the choir, but we need to have a plan. So if somebody has walked through the process of accessing their EAP before, it's going to be much easier to do when they're in a crisis, instead of going, I don't even know where the number is, when last week you could have asked them and there's like, that number's everywhere. It's on every bulletin board. It's everywhere. But when they need it, it's nowhere. So we want to make it really accessible. So and I know this sounds kind of trivial, but it's like we teach tip volunteers. When something's happening, we are the ones that feel like we have to fix it and make it better. When reality is you can't fix somebody who just died or somebody who just had a terminal illness or whatever. What we want to do is acknowledge and validate. And I know that feels like helplessness, but when somebody is going through something, if you acknowledge what they're going through and you validate their feelings, they're not expecting you to fix it. That's just something in our own human being that we want to do. We feel like, okay, we need to say the magic words. And a lot of you have heard me speak before, and I'm telling you, there are no magic words to make it okay for somebody. The best thing you can do is shut up and just listen. Acknowledge and validate. If you walk away with nothing else today, acknowledge and validate what somebody's going through. Then we need to make it okay and say, I'm not an expert here, but when I was going through something, our EAP was awesome, and this is what I did. I reached out, I called the number. When I walk somebody through how to use the EAP, I will give them step by step. Here's the number you called. They're going to answer the phone like this. And then you're going to say this, and give them as much information. When they give you a therapist name or 2 or 3 to choose from, you are always going to get a voicemail because our therapists are busy seeing people. So don't let that discourage you. You will get a voicemail. The trick is to give them as much information as you can about why you're coming in. This is June Vining. I work for blah, blah, blah. I'm really wanting to see somebody about the stress or anxiety I'm feeling at work, or I just got bad news. It's okay to call me back on this number anytime. I'm really looking for an appointment that's afternoon. And if it's virtual, it can really be anytime. So tell them it's okay to call them back, give them the good number, so you're not playing phone tag. I also suggest if you get a name, look it up so you can see what that person looks like. Surprisingly enough, when we see somebody's face, it's like, yeah, I'd talk to them, or whoa, 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 not at all what I'd expect. There's nothing wrong with that. That's you. So just Google and see what their health grade thing is, what they're there. Also telling, when you're making that appointment, giving them as much information about what you want to come in, whether it's elder care or child care or a relationship issue or an addiction issue, so they can make the best match possible. So as supervisors and employers, it's really important for us to know that resource. So if you don't know it yourself, give yourself some homework and call the number to see how easy it is to do it. I would also ask around for who has somebody else gone to see and what's their specialty. You know, I had a list. I spent so much time interviewing counselors and driving when we were actually going in person to see, because I thought if I wouldn't hesitate to send my husband, or I would go to this person. And that makes a huge difference when you're trying to get somebody some support, is I would go see this person. So we want to make it, when we're supporting coworkers and so on, we want to make it as easy as possible. So have the number handy, even sending out emails acknowledging. Like right now, if I had a whole staff, I would be sending something out, and I probably will for the tip volunteers, kind of like, here we go again. You know, we're all listening to this news about the horrible stuff in Colorado. And it's like, and the tip volunteers are trained. I'm sure they're just hurting, like, what can we do? And you're listening to the words everybody's using as they're talking about it. And we're all going back to the last shooting. Or for me personally, I'm going back to, you know, the Reynolds High School shooting. Acknowledge, validate, and say, maybe I'm not the expert in here, but that's why we have a great EAP. Here's the number. And you can talk to them about getting a person that's close to home or that takes evening appointments. Or here's a suggestion of who I've seen. So ask.
That's wonderful advice. And, you know, connecting with the benefits office or anybody with any questions, if you are, you know, administering a program, maybe as part of your onboarding, set up a call and do that with the whole group so that people know exactly what it sounds like. These are all strategies, June, that you've used that have been incredibly successful. But what you're also speaking about is almost creating a peer support program in advance of that EAP experience to help almost triage and support people. Sometimes even picking up the phone is too much. And if we can do that for each other as a supervisor, as a coworker, as an HR person, as a safety person, as a nurse, this is what we all do. It's all of our jobs. Yes.
Right. And here's the thing. Sometimes a lot of people don't know that most EAPs have like a supervisor's line. So if you're a supervisor and you have to have a difficult conversation, you can call your EAP, ask to talk to a supervisor and say, here's my situation. I need to talk to this person, but they're not dressed professionally or blah, blah, blah. Help me. And they'll role play with you and help you with the words. Because most of the time, that's why we're uncomfortable, is we don't want to say the wrong thing. We don't want to make it worse. So they will help you. And that's easy access. You pick up the phone and say, help me with this difficult conversation.
Oh, these incredible resources. We can almost train ourselves really through EAP on supportive supervision and get those conversation starters. It's wonderful advice. Do you have any information on how COVID is affecting mental health and well-being for occupational health and safety professionals? We tend not to think about ourselves, even though we are workers just like everyone else.
Oh gosh. Yes. And this is the biggest one, is we think we need to be strong and tough, you know, as supervisors or in this occupation to handle it. But it's kind of like that old saying about being in the airplane, you know, if we have to use oxygen, we have to put it on ourselves first before the child. And we can't be good stewards of safety, mental, physical, emotional safety, if we're not practicing that ourselves. So what are you doing to take care of yourself? So when you see an employee that's stressed out or topped out or whatever, you can listen, acknowledge and validate what they're going through, and then offer suggestions. And I'm sure that most of us have heard all of the things that people are suggesting right now. Somebody was on early, I think it was Dave, out for a walk, get fresh air, get away from the screens, have some screen-free time, you know, set boundaries for your time, meditation to be in the right mindset, yoga, exercising. You know, when you go to see a mental health professional, and if any of you have, you know, they say, are you eating? Are you sleeping? Are you moving? And I always say to people, eat, sleep, move, relate. Are you eating right? Are you getting enough sleep? Are you moving your body? Are you relating, connecting with somebody every day? So what works for you? What works for, you know, if we put out a blank plan, it's probably not going to work for everybody. But for somebody, it's like, yeah, I can get out when the sun is shining and I can go for a walk. I can stop my morning by, you know, going on, you know, the Calm app or the Headspace app and doing at least a 1-minute meditation. Or I can find 2 times during the day where I'm doing that. I can swap out my coffee for more water. You know, I can look at that bag of chips at 2 o'clock in the afternoon and maybe put carrots or nuts there instead. All the things that we all know up here, but it's putting them into practice. So we have to be models for the people that we are supporting on how to do it. If they see you with unhealthy lifestyles or coping mechanisms, they're not going to have that respect for you. But if you're showing them, here's what I'm doing for my mental health, we have to be able to recognize in ourselves what we really easily see in our coworkers or the people that work for us.
Very good advice. And, you know, again, the theme that keeps coming back that's new in the workplace is this diffusion between work and life, right? That we are now really looking, and I think it opens the conversation because we are talking about, in some ways, personal things in a way that's less stigmatized than it ever has been before, because we're all stressed out. We're all suffering from this. So have you received feedback from workers on the types of self-care strategies that work? You talked about acknowledgement and validation. When a person's taking care of themselves, how can they do that for themselves and show themselves that they are acknowledged?
Sometimes it's finding that buddy to talk to. Maybe it's doing your own personal, counseling, just to say, you know what, COVID has been crazy. I just need a little extra support. So you're having, you know, a conversation with a therapist once a week or once every other week, just to kind of, what do they say, get a checkup from the neck up, to feel how you're doing. I think really sharing what your boundaries are. So if you're somebody that really doesn't have to be available 24/7, then set those boundaries, like, and share that with your work group. I'm really trying to set some good boundaries. So I am going to turn my phone and my computer off, all the alerts and everything at 5 o'clock. They know that they can still call you, but at least you're not getting dinged with emails and alerts that are going on. And I'm going to keep it off all weekend, and I'm available again Monday morning. If there's an emergency, my phone is always on, but I'm going to unplug from all of the work email over the weekend. So you've left them out. They know that you're not going to respond to emails because you're not looking at them. But if there's an emergency, they can certainly get you by phone.
Now that is,
yeah.
Oh, go ahead.
And let everybody know so nobody's judging. Oh, Nicole didn't answer my email on Friday night at 8 o'clock. You know, last week you did. So
this is great because, you know, these are, you know, we're all kind of responding a little bit in our own way, aren't we, to the pressures that we're having in the last year or two. And, you know, to be able to set those boundaries and allow people to engage at their level of comfort and in the way that is appropriate for them. It sure does require us to give each other a little bit more latitude and space, and maybe a little more job control as well, which we know that increased job control is a benefit to a worker's mental health and well-being.
Right. And I would, if I were to give all of you homework today, it would be to find out who your EAP is and call and make an appointment yourself just to say, I want to know how to do this. Even if you don't have an issue you want to talk about, just say, I'm part of this group. I wanted to know how to do it so I can make a referral. COVID's crazy. How do I support my staff or my coworkers? And you might find that you're going to get a little benefit yourself because somebody just listened to you.
That's right. So we have a take home here, and that is EAP wants you to call them. Call them. June, you mentioned a little before we started recording that employers are paying for this benefit whether it's being used or not.
They pay the same amount every month, whether everybody uses it or nobody uses it. And another good thing is even go to your benefit person and ask them, because most EAPs do so much more than just therapy or counseling sessions. There's some free legal advice that you can help get yourself organized. There's child care recommendations. There's elder care recommendations. There's the supervisory line. There's, healthy living and apps you can download on your phone. You can text most EAPs now and get help.
This is wonderful. We've opened our eyes and helped us understand just the value and how comprehensive these EAP programs can be. Thank you so much, June. I think we do have a question.
Okay.
Dee Dee, would you like to share?
I don't think we have a question, unless I missed it. Let's see.
We have
there's a comment. Just agreeing with other health coaching comments about healthy lifestyle mantras. I think that's what I see in there, Nicole.
That's what I see too.
I did offer Leslie, if she wants to jump in with a question, she may or may not have one. I have a question, if nobody else. And I would absolutely say I am so there for EAPs, and I was sharing earlier the support I've gotten through EAPs, which has been phenomenal, and it helps you really understand what it takes. And so that idea of calling first to get a sense if you are in the position of making recommendations to others. This goes a little bit beyond what you're talking about, but I've been thinking a lot about social media. And everyone has their own preferences. Some find it very important to connect, and there's studies showing, right, that for people really actively connecting, especially now with people they care about, that it can be helpful, and others turn it all off. Do you have any general recommendations that you've seen overall about social media access? And it's okay if you don't, but I was thinking about this.
Well, so my answer is yes and no. Professionally, I don't. Personally, I can tell you that something that we started at COVID is to set up private Facebook pages that are secret, which means you can't search them and find them. So I'm from Minnesota. All of my family's back there. I have 26 nieces and nephews. And when I want to connect or say happy birthday, I don't want the whole world knowing about that. So we go in our private Johnson family page, and that's where we share all family stuff. For tip, we have a volunteer only page that you have to be invited to, that we control what goes on there. So people are sharing helpful stuff. Like we get to decide whether it goes there. So you can have your own little group, your own little work group that has a private page. It's not open for everybody. Which is a good way to stay connected and share happy thoughts, or I'm having a tough day, and it's a safe space because the whole world doesn't see it. But and there's ways to set that up. I'm married to a homicide detective, so his Facebook presence is not, I think he's actually like a an undercover teenage girl on there somewhere. I don't even know. So we don't even say his name. We don't, we're doing a coffee challenge with Tip right now, skip it to tip it. And it's like, hey, who wants to skip their coffee today and donate it to Tip? And my staff wanted me to call out all the detectives from Multnomah County. And I'm like, I can't do that. That would be blowing their cover.
Yeah.
But privately. So I think you just need to realize, is this something I just want a group of people to know? Or do I put it on a page and whoever gets to see it? Most of the time, you'll find that it's a group of people that you're wanting to share with.
That's really great advice. Thank you, June. I appreciate that. And I know it's different for everybody. Okay, I'm going to get to a question that is in the chat. We have a couple minutes left. I'm going to read it. Personal safety is also an important component in mental health. How can occupational health and safety professionals help employees feel safe coming to work during COVID?
So again, I'm going to go back to my acknowledge and validate. Listen to what they're saying to you. Because if we just assume it's because they think they're going to get COVID or they're going to give it or something, that might not be the reason. So listen to what their fears are. They haven't gotten the vaccine, or they're worried because they're working with somebody who refuses to get it, or whatever it is. Acknowledge what they're saying and validate. And when we really hear what their fears are, we might be able to work with that and make a plan to make them feel safe, or even say in the words, what would make you feel safe? How can I help you feel safe coming to work or doing your job? But I think we're in such, you're in these professions of being fixers and solvers of problems, and we need to stop and slow things down and listen to what they say and then move forward. Answer. I hope that answered it.
Yeah, thank you. One more, and then I will get off. And Nicole, you can kind of conclude with June. Any suggestions for occupational health and safety professionals to reach out to furloughed employees or laid off workers you hope to recall? That's a very specific question. I'll leave you with that.
Yes, that's a huge one. So let me tell you, all the tip volunteers, I just entered into a contract last November with Multnomah County because they were realizing that they had a bunch of employees that were activated to work the EOC during just the COVID EOC. A lot of people don't even know what an EOC is. So we had people working there and they said, we really need to check on them. Some of them have been away from their job for almost a year. Some of them more than a year. So we reached out by phone. We made 1,500 phone calls. And we reached out to everybody that was activated at the EOC. If we didn't get an answer on the phone call, we sent an email. And we spent, I think, 9,000 minutes on the phone in 6 days. And now people are we got a county email so they could respond, because when we started sending emails, you guys can appreciate this. Initially, it was like, hey, the county's telling us all the time, don't answer an email if you don't know who it's from. And then they would see this random tip volunteers email and they're like, is this a test? Are you testing us? So they set us up with an email so we could email and say, this is June from TIP. We are checking in on everybody who was activated for the EOC for COVID. We just want to know how you're doing. And what we did during those calls was remind them about their EAP. We listened to them. We gave them access if they had a complaint or a concern or congratulations on where to send that and pass that information on, and reassured them that it was all confidential. We weren't going back with anything. So when people are furloughed, and when people are off on injury leave, it's probably more important than ever to find somebody or find people to make those calls on your behalf and say, we're checking in. It's not that Nicole doesn't care, but she gave us this list of people that she wants us to check on. So my name's June and I'm calling for Nicole and I'm wondering how you're doing. Is there anything, any information? Are you aware of your EAP? How to call, what the phone number is, any information I can bring back. So we did that for them, and now the city of Portland is asking us to make calls to their ECC. So very important and good for you for thinking about them.
That's an incredible set of advice there, and how good that feels as a worker to know that my employer is thinking about these very important but highly nuanced issues that we're all facing. That's brilliant. June, I think we have one more question.
Okay.
Is there okay, I'm just going to read it here. It appears that there may be some consequences for first responders, long-term consequences for first responders and healthcare workers choosing to leave their direct care work. Is there something employers can do now to help folks stay in these very essential jobs?
Well, again, I think that we're not listening or not paying attention when people are at their limit.
Yeah.
And just saying, hey, is taking a break, or how about let's take a month off. I don't know what the rules are for everybody, but if there's an option to give them a break and then let's come back and revisit it. we could probably save a lot, because sometimes just being away. I know I went to Bend over the weekend with my husband and daughter's family and the 2 little kids. And it's amazing how just getting away in sunshine and fresh air and no work, coming back Sunday night and Monday morning was refreshing. So it's, I think all of you need to be held accountable for your boundaries and your personal time. And that's what we want to make sure that the people that work with us and for us also do. We're going to show them how to take care of themselves by doing it ourselves.
Folks, you heard it here. We all need to take care of ourselves. And June says it's okay for us to do that. And isn't it interesting that sometimes as occupational health and safety professionals, we still feel like we need permission to take care of ourselves. June, thank you so much. It is an honor to have you with us. And I encourage everyone to reach out to us with questions about EAP. If you have any ideas, any tips on how to, if you need ideas or tips on how to increase your utilization and further support your employees. Thank you so much for joining us today.
You're very welcome.